We've already discussed the importance of etiology. If you don't identify and address the underlying cause of malocclusion, treatment will be difficult and relapses are likely to occur. Dental problems, arch problems, and skeletal problems are all issues with a patient's anatomy. But some malocclusion is caused by a patient's behavior. Habits like thumb sucking, tongue thrusting, lip sucking, nail biting, mouth breathing, and clenching and bruxism. To identify these issues, naturally you'll want to start by collecting a patient questionnaire and a full medical history, followed by a clinical examination. But people aren't always aware of their own habits, and you're unlikely to observe most of these behaviors firsthand. It takes a bit of detective work to identify the signs of a harmful habit. Thumb, or finger sucking, manifests itself in some common clinical findings. The upper incisors are proclined, causing spacing. The lower incisors are retroclined, causing crowding. The upper alveolus may be distorted, and the thumb or finger involved may have dry, chapped skin with a callus. Thumb sucking can undermine efforts to align the teeth and cause relapse if it persists in retention. Like thumb sucking, lip sucking results in proclined upper incisors, causing spacing, and retroclined lower incisors, causing crowding. The lower lip may be enlarged and red, and with dryness and chafing beyond the vermilion border. You may also find tooth indentations on the lip. Lip sucking can undermine efforts to align the teeth and cause relapse if it persists in retention. Tongue thrusting can cause proclination of both the upper and lower incisors. The resultant spacing is often uniformly distributed between the anterior teeth. The tongue may dart between the teeth as the patient swallows with their lips apart. Tongue thrusting can undermine efforts to align the teeth and cause relapse if it persists in retention. Nail biting can wear down the incisal edges. Some patients also use their fingernails to pry teeth apart, which can cause anterior spacing and misalignment. The fingernails may be reduced to expose the nail bed. It's impossible to bite your nails while wearing aligners. In fact, some patients report that clear aligners help them break the habit. Nail biting can still cause problems, however, if the patient takes the aligners out to bite their nails, or if the habit comes back in retention. Mouth breathing can result in a narrow upper arch, causing a posterior crossbite and an anterior open bite. It may manifest in an increased facial height, with the mandible positioned lower and further back than typical. You may observe a low tongue posture, dry, pale lips that rest apart, and inflamed, dry gingiva around the labial surfaces of the anterior teeth. Mouth breathing can undermine efforts to expand the teeth or close an anterior open bite. Gingival irritation may also be an issue. There is a high risk of relapse, so you may consider permanent retention or continued nighttime appliance wear as long as the habit persists. Clenching and bruxism are common causes of enamel and dentin wear, but in severe situations can also result in tooth fractures and loss of vertical facial height, leading to a more brachycephalic face form, meaning a square-shaped face. You may observe prominent masseter muscles, and your patient may complain of jaw muscle and joint pain. Clenching and bruxism can quickly wear through aligners and retainers. Tooth movement may be impeded, prolonging treatment. Deep bites are particularly difficult to correct. After treatment, an occlusal guard may be more effective than a traditional retainer. Harmful dental habits are most common in children, but sometimes they persist into adulthood. The bad news is, it's extremely difficult for adults to break a habit. These habits interfere with movement and increase the chance of relapse after treatment. The good news is, once you learn to recognize these habits, you can be prepared. You can choose appropriate cases to treat, set realistic expectations, and work with your patients to manage their condition. In this series, we've learned why orthodontics matters, Engel's classifications of bite relationships, and Andrew's 6 keys to ideal occlusion. We've learned to identify dental problems, arch problems, skeletal problems, and harmful habits. This concludes our introduction to orthodontics.